With fall starting, Walgreens Chief Medical Officer Dr. Kevin Bain is sharing his perspective on this year's fall respiratory illness season and how you can best protect yourself. Good morning, doctor. How are you?
Good morning, Brad. How are you?
Well, I'll tell you, I'm kind of a little worried because I do have like a respiratory problem here. I'm glad we're talking about this. And I didn't realize it's seasons that really cause my breathing to, of course, be shallow, be kind of, stopping me from doing things, and I'm taking medicine for it. But let's talk about this and what, of course, is going to be the fall respiratory season going on here.
Yeah, well, I'll tell you, Brad, you're like many Americans, and what we do is we try to get a sense for what's going to happen by looking at the Southern Hemisphere. And what they've seen during their winter is a very active respiratory season, and we expect the same. That's what happened last year. We expect it'll happen this year, so it's very important to make sure you're protected.
And with that, we're talking about, of course, vaccines people should get this time of year, and it's a little different than what everyone's thinking, right?
Yeah, what I think the new mindset here is not that we're getting boosted for COVID, but that it's much like the annual flu shot that we get. And so the FDA and the CDC just approved the new COVID vaccine, and that's a vaccine that we're probably going to be getting annually. It's available as soon as Monday in stores. And so I'm recommending that people go online, schedule that appointment, get the flu, get the COVID. You may need other vaccines. We can help with that.
I like it. Let's talk about what actually is respiratory, season, and also what people can see in symptoms in their self.
Yeah, the most common things that we see are that people develop sore throat, cough, runny nose, a head cold. Everyone's had it. Of course, with the symptoms, you don't know what's causing it, so it's important to be tested. And we're offering flu and COVID testing in our Walgreens stores. Then, when you know what it is, you have an opportunity to treat. There are oral antivirals for flu and COVID, but you can always treat with over-the-counter medications to treat the symptoms and to feel better.
Yeah. You said something about, of course, making sure you're getting tested. Let's talk about if someone tests positive for this, what do they need to do?
Right, so if you test positive for either flu or COVID, we have oral antivirals, and it's a good idea to be in touch with your physician to find out if you need one. Now, there are a lot of reasons to take it. It'll lessen the course of the disease, but in the case of COVID, may even decrease long COVID. So there are reasons to be tested, find out what's causing your symptoms, and then, when appropriate, be treated.
Yeah, I think the big part, doctor, is that we have to talk about it and not be ashamed, not think, oh my goodness, I'm out of breath, I better not say anything to anybody, it makes me look like I can't work out or anything, but that's not my problem. It's just a symptom that I have and it comes about, and I think that's very important, isn't it?
Brad, it happens to the best of us. I mean, look, even if you're vaccinated, you may still get a viral illness. You might get the flu, you might get COVID, but here's the important part, Brad. You're going to lessen the intensity. So even if you are infected, the likelihood is you're not going to have a bad outcome, and that's the most important thing.
Yeah. Is there anything we should do, kind of like as we are feeling those symptoms, we've done everything, should we just rest, or should we walk a little more to open our lungs up? What's some things we should do really quick?
Yeah, I mean, I think let your body be the guide, right? So if you're feeling sort of wiped out, again, I would recommend that you treat symptoms and let the illness take its course. Make sure you're drinking plenty of fluids. That's probably the best piece of advice I can give you, because you don't want to get dehydrated, and then as much sleep as possible.
Yeah, I love you said that, because I didn't realize it until my doctor said, how much water are you drinking? How much, fluids are you drinking? And not soda or alcohol, but like fluid, Gatorade, something like that. And I was like, well, not too much. Once I started doing that, I just started to see my breathing a little bit better, and getting the vaccine and the flu, shot really helps out. So it's so important there.
Yeah, what I'd say about that is that when people get viral illnesses, usually the body will, take care of the virus itself. But if you get dehydrated, if you get behind on fluids, you can get really sick. Now, you mentioned Coke and coffee and things like alcohol. These are all dehydrating. These actually make your body lose fluids. So you just want to do basic things. Water is fine. People talk about whether or not you need Gatorade and electrolytes. Water will do it. Make sure you stay well hydrated.
All right, doctor, the most important question we can ask here, and very important, how can people make appointments to get the COVID vaccine and a flu shot?
Right. So the easiest way to make an appointment is to use our app or go to Walgreens.com. And then you can go ahead and schedule your flu shot, your COVID shot, and if you need any other vaccines, we're here to help you, and we're trying to make it as easy as possible.
I like that. Doctor, thank you very much for joining us this morning.
Thank you, Brad.